honestly, looking at this EKG, I would never know anything was wrong with your heart.
I met Roberto because his family reached out to me. Roberto was living in El Salvador. One of his relatives was a cardiologist, and Roberto was complaining of some chest discomfort. He had a cardiac catheterization in El Salvador that revealed that his heart was very sick.
Okay. All right, so I'm just going to take a listen to your heart.
Most of his major arteries were severely blocked with cholesterol.
Dr. Dagari was strongly recommended for a friend of our family who is a doctor. He did not make a mistake when he recommended Dr. Dagari. He has been looking after me ever since he got me as a patient, and he was the one who introduced me to the surgery.
What was interesting about the whole case was they were so enthusiastic about getting to us here in New York at Good Samaritan Hospital, St. Francis Heart Center. They didn't even want to wait to have any accommodations made in terms of medical transport. So they actually booked a flight for the next morning and flew over to New York. When he arrived, I knew that his disease was severe, and I knew that we had to act quickly, otherwise he would be at risk for bad events. Roberto underwent a cardiac catheterization at Good Samaritan Hospital. We felt that his disease was even worse than we thought. He basically had no artery in his heart that was not severely diseased. So we knew this level of disease required a highly sophisticated procedure in a center that had a lot of experience, performed by the cardiothoracic surgeons from St. Francis at Good Samaritan Hospital. So Roberto was referred for coronary artery bypass graft surgery, or CABG. This is a top-rate team. They're used to dealing with very complicated cases, and they do it over and over and over again. Roberto underwent about as complex a procedure in all of medicine, where they actually stopped the heart. And at that point, they bypass, or they divert blood around the blockages with new arteries and veins.
Sound great.
Okay.
We were very relieved that he was there, and that at that point we could help him.
It doesn't look like a hospital. It looks like a hotel. Everybody was up to date. They have everything.
Roberto has had as good a response to open heart surgery as any patient could have. He had severe blockages. Almost all the arteries in his heart were blocked with cholesterol. But the good news was his heart was strong. So he went through the surgery without an issue, has had an amazing recovery. His outlook is fantastic. It's very promising.
The first thing that I want to say to Dr. Dagari is thanks for everything you've done, thanks to your team. They are really committed to the patients, and all the hospital staff has nice, and I love them. I will say that in Catholic services and Good Sam, you're not alone. They treat me like a prince.